Hello and welcome. My name is Janelle Mirzai. I am the healthcare facilitator at UCSB. Welcome to the open enrollment retiree highlights for 2026. Open enrollment starts Thursday, October 30th at 8 a.m. Pacific Standard Time and ends Friday, November 21st, 5 p.m. Pacific Standard Time. Some health plans are changing in 2026. Health plans for our Medicare population will remain the same. However, if you are not in a Medicare plan or you're in a split family plan, this change may affect you. First, the transition to Blue Shield of California from Anthem Blue Cross for faculty, staff, and non-Medicare retiree PPO plans. After a competitive bid process, Blue Shield was selected to replace Anthem as a third-party administrator for our PPO plans in 2026 for UC Care and the Health Savings Plus plan. Additionally, UC is offering a new high-deductible health plan compatible with the Health Savings Account, HSA. The new plan is called Health Savings Plus, and it will replace both the UC Health Savings Plan and the Core Plan. Members of those plans will default into the new Health Savings Plus plan unless they enroll into another plan during open enrollment. The Health Savings Plus plan is designed to offer the advantages of the HSA, including a larger contribution from UC with more affordable employee contributions than the current Health Savings Plan. For a more detailed overview of our non-Medicare plans, please see our medical plan and non-medical plan changes presentation. I will primarily discuss our UC Medicare plans. Open enrollment frequently asked questions. If I like what I have, do I need to do anything during open enrollment? No. If you like the plan that you're enrolled in, you don't need to make any changes. When does open enrollment changes become effective? January 1st, 2026. How do I enroll or change my medical, dental, or legal plans? You can sign in or register on UC Raise, or you can contact RASC. RASC updates during open enrollment 2026. RASC will continue to host office hours hosted by the insurance team, weekly Medicare office hours hosted by Medicare liaison Alicia. Attendees have the option to book one-on-one appointments with Alicia if needed. Monthly Medicare webinars hosted by the insurance liaisons. RASC call center opening at 7 a.m. Call team to assist with navigation on UC Raise open enrollment. And what's new? Updates to UC Raise office hours registration link added to the open enrollment landing page. Open enrollment confirmation screen updated with language emphasizing timely Medicare form submission. Prompt added to update demographics before continuing open enrollment. New retiree FAQs created by RASC, and there's an updated UBIN 100 form. As previously mentioned, Medicare plans will remain the same in 2026. Please keep in mind that if you switch Medicare plans, you must also remember to complete the appropriate UBIN form and return to RASC. The partner plans for split families will change for UC Medicare PPO split families. Your only option with the UC Medicare PPO is with UC Care. No split families with UC Medicare PPO and the Health Savings Plus plan due to IRS rules. Again, please keep in mind that if you switch partner plans, your Medicare eligible family members must also complete the appropriate UBIN form and return it to RASC. For Medicare retirees who live outside of California, your benefits will be administered through VIA Benefits. It's when all covered family members must be 65 and plus and have Medicare. It does not affect dental, vision, legal coverage. UC provides premium support, a health reimbursement account, an HRA, and new, starting in 2026, a $4,000 per covered person, each starting in January, up from the $3,000 from last year. It is subject to graduated eligibility. You can use HRA money to buy Medigap or Medicare Advantage plans, pay for Medicare Part B and D, catastrophic coverage special payments for pharmacy. Medicare and UC. Medicare is a federal health insurance program for those 65 and some disabled. Part A is hospital insurance. Its premium is free for most. Part B is the medical insurance. It's $185 a month if newly enrolled in 2025, and more if you have a MAGI of 106K single, a year and $200 in K-12 for couples. Medicare and UC plans. There are two ways to coordinate. First is to keep your Medicare, which is original Medicare, with a supplemental plan. Medicare will be your primary and Anthem Blue Cross will be your secondary. Medicare providers must be used. 99% of doctors are part of Medicare. 96% of U.S. physicians participate in Medicare and do not balance bill. Providers that do not accept assignment can charge up to 15% or more. Providers who have opted out of Medicare are not covered. The second way to coordinate is you assign your Medicare to an Advantage plan, a Medicare Advantage plan. Kaiser Senior Advantage and UC Medicare Choice are our options at UC. You must sign over your Medicare benefits to the plan by form. You use Plan ID card instead of a Medicare card. Medicare pays a flat monthly fee to the insurance company, and Medicare cannot be used separately from the Medicare Advantage plan. Let's review our Medicare and non-Medicare PPO plans. UC Medicare PPO coverage. Original Medicare primary, Medicare PPO secondary. Caution, must use Medicare providers. The exception will be for mental health providers unless not covered by Medicare. Deductible only applies if not covered by Medicare, but covered by the plan. Must use Medicare providers for non-behavioral health services. Diabetic supplies. Medicare Part B must be billed first, Navitus second. It's a $2,100 cap for pharmacy out-of-pocket maximum for prescription drugs. The deductible is $100 and out-of-pocket max is $1,500, which remains the same from last year. Medicare will be primary. Prior authorization is rarely required. Use any Medicare provider for Medicare covered services. Use any licensed provider for behavioral health, comprehensive worldwide coverage, acupuncture coverage, hearing aid coverage at 80%. Skilled nursing facility care must meet Medicare's requirements, including having been in a hospital at least 3 days and entered a Medicare-approved facility within 30 days after leaving the hospital. UC high option coverage. For most services, plan pays 100% of the balance after Medicare. You pay nothing. A $50 annual deductible. 20% coinsurance applies only to services not covered by Medicare. An example will be acupuncture. Original Medicare is primary. UC high option is secondary. Must use Medicare providers. Exceptions for benefits beyond Medicare. Deductible only applies if not covered by Medicare, but covered by the plan. There is a $50 deductible and a $1,050 out-of-pocket maximum, which remains the same from 2025. New is the additional travel vaccines for UC Care, Health Savings Plus, and Medicare PPO and high option plans. For our Medicare PPO high option, after the deductible is met, for in-network is 20% of allowed amount. For UC Care Tier 1 and 2, it's $0. And for the Health Savings Plus plan, it's 30% coinsurance. Let's have a quick overview of our non-Medicare PPO plan changes for 2026. For UC Care PPO and Health Savings Plus, there will be new criteria for all weight loss coverage for weight management. You must have a BMI of 40 or higher, regardless of comorbidity conditions for the GLP-1s. Members currently on these drugs who started with at least 40 BMI could continue with recertification. And as you may know, Blue Shield is the new vendor for both UC Care and the Health Savings Plus plan. For our Health Savings Plus plan, there is an increase in HSA contributions for self and family, $4,400 for single, $8,750 family, increasing UC contribution for the year up to $750 for single and up to $1,500 for family coverage. Same catch-up contribution for members 55 and over is $1,000 for the year. Same HSA custodian with health equity. You are not eligible to enroll in the UC Health Savings Plus plan if you are already enrolled in Medicare or in a split family enrollment. At least one family member is enrolled in Medicare. Plan to enroll in the UC's General Purpose Health Flexible Spending Account FSA. And new, non-Medicare retirees who were not enrolled in the UC Health Savings Plan while employed by UC are now eligible for the Health Savings Plus plan during open enrollment. So what that means is, as a retiree who is not yet 65, they do have the option to enroll into the Health Savings Plus plan during open enrollment. Let's move on to the HMO and Medicare Advantage plan changes. For UC Blue and Gold HMO plan changes for the BMI criteria for weight loss and appetite suppressants starting in 2026, you must have a BMI of 40 plus. Existing members using these medications may continue if the prescribing physician certifies medical necessity and meets the health net criteria for continuation of therapy. Existing members will not be required to have a BMI of 40 plus. Also, for 2026, musculoskeletal care management and interventional pain management starting in 2026, Evolvent will manage prior authorizations. And then share care virtual cooking classes starting in 2026, up to 5 virtual cooking classes at UC locations at no cost. For Kaiser HMO plan, the BMI criteria for weight loss and anti-obesity drugs in 2026, you must have a BMI of 40 or higher, and members who started treatment with the BMI of 40 plus may access the medications for up to 24 months if medically necessary. Those who started with a BMI below 40 will no longer have access to the medications if they do not have a comorbidity outlined by Kaiser Permanente. For Kaiser Senior Advantage Plan, there is a copay increase for emergency room and inpatient hospital visits. So starting in 2026, emergency room copay is $100, waived if admitted, and for inpatient hospital copay, it's $350. Let's move on to UC Medicare Choice. It offers to use any Medicare provider who will bill United Healthcare, use any licensed provider for behavioral health, comprehensive worldwide coverage, no 3-day hospitalization required prior to the use of skilled nursing facilities, foot orthotics, no diagnosis of diabetes is necessary. You also have a gym membership, prior authorization required for many services, must use Medicare providers for non-behavioral health services. Hearing aid benefit is limited to $2,000, 24 visit annual limit on acupuncture and chiropractic services. Some doctors will not bill Medicare Advantage plan. Please confirm with the provider if they accept Medicare Advantage plans. Here are some of the major changes for the UC Medicare Choice Plan for 2026. There are copay increases for emergency room, inpatient stay, Part B copay for infusion therapy, in-office setting, Part D deductible for both Tiers 3 and 4, Part D copay for specialty pharmacy drugs. The fitness program starting in 2026 will be replaced by Renew Act. Personal emergency system will discontinue in 2026, and Calm Act will be available starting in 2026. In the previous slide, you saw the cost for Medicare Part B copay and Medicare Part D deductible. Let's dive into the difference between Part D deductible and Medicare Part B copay. Part D drug coverage deductible, $100 for Tier 3 and 4 combined, except for covered insulin products and most adult Part D vaccines. What vaccines are not subject to deductible? United Healthcare will cover all advisory committee on the immunization practices, adult recommended vaccines that is coverable under the Part D benefit for $0 copay, regardless of their tier status. This will continue in 2026. Example vaccines include MMR, shingles vaccine, RSV, Diphtheria, tetanus, peritus, and polio vaccines. The complete list is located here with a link. Medicare Part B prescription drugs, it's a $30 copayment. Part B chemotherapy drugs and vaccines would continue to be covered at a $0 copayment. What chemotherapy drugs and vaccines would remain at $0 copay? United Healthcare will continue to cover Part B vaccines at $0 copay, and that includes pneumococcal, influenza, COVID, hepatitis B, vaccines for high-risk individuals. Chemotherapy drugs under the $0 benefit are the infusible or IV administered drugs that are administered in the provider's office or an outpatient facility. And then this $0 chemotherapy drug benefit also include oral therapy drugs that are dispensed by the pharmacy but determined to be purely covered under the Part B CMS. 2026 Medicare Part D CMS mandates. The 2026 Medicare Part D CMS mandates will cap at the out-of-pocket prescription drug cost limit at $2,100 for Medicare for Part D members. So this is about a $100 increase from last year. Medical plan premiums. UC premiums are deducted from your UC pension. Medicare premiums are paid by you out of Social Security income or through Medicare Easy Pay or through quarterly billing. How are your premiums calculated? If you have 100% of the UC contribution, please check the rate chart. For graduate eligibility, please log into UC Raise. You can check the retiree premium estimator, call RASC, or you can ask Alex, the virtual counselor. 2026 plan costs for UC retirees. The next few slides convey monthly costs for medical coverage that applies to retirees eligible for 100% of the UC employer contribution toward the premium of each plan. If you are subject to graduate eligibility and therefore not eligible for the maximum UC employer contribution, your costs may be higher than those listed in this presentation. Sign into your UC Raise account beginning October 27, 2025 to view your 2026 costs. Here are the 2026 costs for retirees who are eligible for the maximum UC contribution and when all family members are enrolled in Medicare. And again, this is based on if you have 100% of UC employer contribution. Here are the 2026 costs for retirees who are eligible for the maximum UC contribution when one or more family members are not Medicare eligible. This chart is for those who are in split families. And finally, these are the 2026 costs for non-Medicare and for those who are not yet Medicare eligible. Again, these are the rates for retirees who are not eligible for the maximum UC contribution. So if you're subject to graduate eligibility, you can review your rates on UC Raise starting October 27th. Starting with Delta Dental, UC is continuing their partnership with Delta Dental for both PPO and HMO plans. Earlier this year, UC conducted a comprehensive dental RFP to evaluate our plans and provider networks. A key finding was that provider terminations are not unique to Delta Dental, but rather are a trend across the entire dental industry. Our goal is to support members through these changes and to help minimize disruption to their care. So to ease the impact of network changes starting January 1st, 2026, UC is introducing enhanced coverage for PPO plan members receiving care from Premier and out-of-network providers. What will happen is the maximum contract allowance limits for silience, root canals, gum disease, and oral surgery will increase from 75% to 80%. These enhancements are designed to provide financial relief to individuals seeking treatment from non-PPO providers. As a reminder, PPO providers still offer the highest value, so members are encouraged to use in-network dentists whenever possible. As for the Delta Dental Care USA plan, its plan design will remain unchanged for 2026. Moving on to vision, we are continuing our partnership with VSP. No plan design changes. Premium increase rates to 2% for retirees due to increased utilization and industry trends. There are no rate changes for legal. We continue our partnership with ARG. Okay, 2026 member ID cards. For member ID cards, UC Medicare PPO, UC High Option, UC Medicare PPO without pharmacy, and UC Medicare Choice will all receive new member ID cards. Fidelity. Andrew Fung is our locations financial consultant. He can help you with understanding your retirement saving program, evaluating your individual situation and priorities, rollovers into UC retirement saving program, comprehensive retirement income planning, legacy planning, charitable giving, and tax strategies. And again, this year, RASC will be hosting open enrollment office hours. Join every Thursday from noon to 1 p.m. until November 20th. Resources. Please check out the Open Enrollment website for more content and resources. RASC call center will be open at 7 a.m. for open enrollment. The Maritime Retiree Coordinator is Ellen Pasternak, and I'm Janelle Merzai, the Healthcare Facilitator. Recorded videos of the retiree open enrollment highlights and the medical plan changes for medical plan and non-medical plans will be posted on the Healthcare Facilitator website. And that concludes this presentation. Thank you so much for joining us.